Look, I mentioned at the start of the program that I get sick and tired of the fact that regional and rural Australia gets treated like the poor cousins when it comes to the provision of health services. Now, we all know Victoria is broke. I mean, that's just a fact, and it's going to be broke for a very long time. So what the Treasurer, Tim Pallas, and the Premier, Jacinta Allen, who we've talked a lot about tonight, what they've had to do is tell the health providers that they've got to cut their budgets. I mean, there's simply no money around. And this is going to deliver a crisis for regional and rural Victoria. Now, they're scrambling to cut costs in a bid to ease that crippling debt. Now, tens of thousands of Victorians, it's reported in the Herald Sun this week, are now facing being left without critical emergency care. Now, one of the places most badly affected is the Mildura Base Hospital. Now, Herald Sun reported that the only way that hospital can meet Labor's tough new targets is by, can you believe this? And if you know Mildura, it's quite remote, very remote. In fact, it's in the most remote corner of Victoria. The only way they can meet those targets is by shutting down their emergency department, ending paediatric care. There was even talk about having to shut down other arms of the hospital. Joining me to discuss this is Nationals member for Mildura, Jade Benham. Jade, what the hell has this come to?
I mean, if you needed a reality check on how dire the system is in Victoria as far as public health goes, this is it. When you have a health minister telling the local board and the local management that they need to do better than the practical measures the board had already outlined, it is just abhorrent. It's insanity. And given that our nearest health service is 400 kilometres away and we service a tri-state area, you know, we're far west New South Wales and the Riverland in South Australia as well, it's absolutely insane.
So you're a proud Mallee girl. You love that area. But, I mean, for the rest of Australia watching us tonight, I mean, just explain, Mildura is as far away from Melbourne as you can get in Victoria without going across the Murray into New South Wales or west into South Australia. Where would your nearest emergency department be if, God forbid, the Mildura Hospital had to shut theirs?
It would be Bendigo. And we can see... Bendigo, and it is harder to get to than it is to Melbourne. It is insane. Bendigo is our nearest. There's Swan Hill, but Swan Hill are under construction at the moment, so their capacity is, even though their population is much smaller, there is an emergency room there, but Bendigo is where they are going to push patients.
So if I'm out on a farm and I'm doing some labour that requires me to use heavy machinery and I get badly hurt, am I being flown to Bendigo or am I being packed into the back of an ambulance and driven down the highway?
You are being put in an ambulance. Now, I've been speaking to ambulance members over the weekend, and ambulance members in the far northwest of the state, in fact, statewide, are under such pressure. But when you've got ambulances even making the trip between Robinvale and Mildura, because there's no emergency room in Robinvale, I mean, our ambos are already so overworked, and to take them 400 kilometres away is just insanity. I do know that there are 22 medical flights per day already out of Mildura Regional Airport. That is almost one an hour. It's crazy.
Who's paying for that?
Well, I mean, they're Royal Flying Doctors and sometimes Ambulance Victoria, but Ambulance Victoria are also in huge financial strife at the moment, and I'm sure that there'll be more to come on that in the next few days. But it's essentially the taxpayer. The taxpayer's paying for this, and it's just a brutal reminder that this Allen Labor government can't prioritise, certainly can't manage money or the health system. And it's people like us in Mildura and the Mallee that are paying the price every single day.
We're talking to Jade Benham, who's the Nationals member for Mildura. Explain to me, forget about the emergency department for a second. If I'm a pregnant mum and need to give birth and suddenly something might go wrong, or if I need paediatric care, what's the hospital providing in Mildura for me with these cuts in place?
Well, currently we have a new paediatric unit and we have maternity. I had my two sons in Mildura at the maternity services there. But what the government is asking of management and the board is to illustrate that to break even and get to a break even position, they need to cut maternity services. Now, that is absolutely ludicrous for a community that is so far away. I mean, we're the most isolated regional city in the state. What would we do? We would have to either make plans to go to Bendigo or Swan Hill or somewhere else that's also under extreme pressure to birth. Now, I know that when you are pregnant and just about ready to give birth, things don't always go to plan. So that it's just not practical. It's just not.
On the Jade, on the broader question, I mean, how does your community, the people of Mildura, feel when they see the state Labor government ploughing more money? And in fact, the Premier Jacinda Allen last week said we are ploughing ahead with the suburban rail loop, which, as I've described it, a train line from nowhere to somewhere no one wants to go. How do you feel as a taxpayer of Victoria when you see all of that money going into these city-based projects, which, to my eye, are all about saving Labor's seats in suburban Melbourne?
Of course they are, and keeping the unions like the CFMEU happy. Meanwhile, us up here in the great northwest of the state that are producing all of the food for the city are still without a passenger rail service. We're still without an efficiently running rail freight service, and the trucks are just getting bigger. The roads are crumbling. So when we see, and this is one of my biggest bugbears, when we see all of that money and paying $26 million a day in interest repayments, when we see all of that money going into huge holes under the city and a suburban rail loop, we are just befuddled, I think is the most diplomatic way I could put it at the moment. But it is just crazy. And people are angry. They have had enough. They know that Labor has been on the nose for a long time. And it's just, as you said earlier, Steve, we just feel like the poor cousins. We're just out here to grow the food.
Well, I think it's pathetic, and good luck to you. Let's keep in touch, and anytime you want to air your grievances on this issue, I'd love to have you back on the program, Jade. Thanks a lot.
Thanks so much, Steve. Appreciate the time.